Well, hello, it's Dr. Charles from Royale Aesthetics and Beauty, and just wanted to talk to you about one of the challenges that we sometimes face in the medical spa, and that is people that come in and they're worried about their lower face. We have so many options. We're talking about the forehead, the cheeks, the upper face. We have a lot of procedures, techniques that we can use to address concerns in the upper face, whether Botox, fillers, microneedling devices, energy-based devices, lasers, IPL. But when people come in complaining of the effects of age on the lower face, it's much more challenging. There's a very limited role for tox, a very limited role for fillers in the lower face. In fact, if you do use fillers in the lower face, you can sometimes get, a short-term benefit, sharpen the jawline, maybe fill in some of the marionette lines, those kind of things. But long term, that filler, especially if it's overdone, starts leading to a masculinizing effect on a female. On a male, it's not such a big deal to enlarge the lower face, but anytime you fill the lower face in a woman, you start moving towards a masculine look, and a lot of women, for good reason, don't like that look. And so, when you start looking at the lower face, you can get a little mileage out of putting some cheek filler in there, kind of lift up the face, which helps address some of the jowliness and the sagging. As you can see in this beautiful lady right here, she's just got a little bit of extra tissue down here. You can see the effects of gravity and skin laxity starting to pull down the neck, giving you that heavy jowly look. And so when we talked to her, we said, well, there's a lot of things we can do right here, but we really recommended our procedure FaceTite. I said you could also think about a neck lift or surgical facelift, but those obviously are quite expensive, have a significant amount of downtime, and not a trivial complication rate. And so she was interested in more of a minimally invasive approach. And so with that, we actually talked about our FaceTite device, which sort of bridges the gap between incisional plastic surgery and more needle-based techniques. And so the FaceTite device, a very neat device, has a little probe right here that we can slip under the skin, usually even through an 18 gauge needle poke, to get into the area of the jawline and the submental fat right here. We couple that with a little bit of micro liposuction using very small cannulas to remove some of the extra fat in that submental space. If you just remove the fat, though, it doesn't do anything for the skin laxity. You still have the jowliness, you still have the skin hanging down. And so we did do the FaceTite procedure on her through 3 little incisions, one behind the ear, one under the chin, one behind the other ear. And this before and after picture was taken shortly after the FaceTite. Very little downtime. Usually, you can get bruising, but bruising is rare. There's typically very little in the way of discomfort from this procedure. The people that have complained of discomfort, typically the night after or the night of just Tylenol. So very minimal pain and discomfort, very little downtime. We've had people actually go to work the next day after this procedure. But as you can see, she has a very, after the procedure, very nice defined jawline here. You can see that submental fat is gone, leaving a nice angle between her mandible and her neck. Instead of having the what we call the chin neck, she actually has a chin and she has a neck. Very nice result. You look at this and you almost get the feeling that the lady on my left, if you're looking at the picture the same way I am, is the daughter of the lady to my right. So FaceTite, one of the procedures that we can use to address the lower face, which is one of the more challenging dilemmas in aesthetic medicine. Certainly there's incisional surgery to take care of this area, but less cost, less downtime, less risk of complications. FaceTite procedure bridges that gap. And thank you for your attention.